Welcome to Telehealth and Tattoos. I'm Nicole Baldwin, nurse practitioner, as well as my good colleague here, Kelly White, who's also a nurse practitioner. Today, we're going to talk to you about GLP-1s. What the heck is it? What's the skinny on it, if you will? But we also want to go over some important things, contraindications, things like that, because when it all boils down to is your safety. And Kelly and I are really big on prevention. We don't want to wait until you're diabetic to help treat you. And so we want to educate you, make sure things are right for you. Just be mindful. This is not considered medical advice. This is just two gals having a conversation that you're privy to. And this certainly does not constitute a patient-provider relationship. So Kelly, let's just start off with contraindications. Who can and can't take this medication where the risk is greater than the benefit? Because, in medicine and with everything in the world, you always want to weigh the risk versus benefit, right? Is the benefit of whatever worth the risk? And so medicine is certainly a great example of risk versus benefit, right? We always want to measure that. So what are the contraindications where the risk is too high, would not want to be on the GLP-1 therapy? If you want to talk about that, that'd be great.
I think one of the first things we have to think about is your BMI. So contraindications are a BMI under and overweight range. So if you've never been on weight loss medications, you've never taken GLP-1 medications, this is your brand new first run out of the box, and you're considering this, but your BMI is under that overweight range, then this is not the medication for you. Most providers will not treat you with GLP-1 medications if your BMI does not hit a certain range. All providers have a different threshold, but Nicole and I go with overweight. Some wait until you hit the obese number before they treat. Nicole and I are kind of the mindset that these medications have been studied thoroughly, especially recently because it's turned into such a fad. But we've come to learn that they are very protective over certain organs. They are renal protective, they are cardioprotective. There's a lot of things that these medications do that help you in the long run from developing heart disease, from developing kidney disease, for lots of reasons that we can go into in another episode. But we cut off that threshold at being quote unquote overweight. So that's the first one. And then the big ones are if you have a personal or family history of medullary thyroid cancer or multiple endocrine neoplasia type 2. Those are absolute contraindications. You cannot take this medication. And that is because studies have shown over and over and over again that these medications can and will cause those types of cancers. So if you have a personal or a direct family history of these cancers, then we will not treat you. Now, that doesn't mean that if you have a family history of thyroid cancer that you're not a candidate. Please come see us. Let's chat about it. Let's figure out, because a lot of people, that's pretty rare. Those cancers
90% of thyroid cancers are papillary, follicular.
Yeah. And that's not the same thing.
Right. That is not the same thing. That is not the same thing. So thyroid cancer is one thing, but when you have somebody in your family or in your direct family that is diagnosed with thyroid cancer, they are going to have a biopsy report. They're going to have a biopsy report that's going to say, okay, this is what type of cancer it is. And that's really what we want to take a look at to really rule you in that it's safe for you.
Yeah. And most people, I mean, Nicole, I think you can probably vouch for this. Most people's family members, they either kept a copy of that report or their endocrinologist has a copy of that report.
They know.
And I'll just tell my patients, just shoot it to me through your patient portal, or while we're on a visit, hold it up to the camera. Let me take a look at it, something. And I have never, not one time, nixed someone for a family history of one of those types of cancers. It's always been like papillary or something that was not actually one of those two types. In fact, I've not ever seen one of those two types as a contraindication to starting therapy. So just because you have a family member that has that type, please don't think that that nixes you from the program. Go ahead and come see us. Let's chat about it. The likelihood of it being one of those types is not very high. So those are the absolute contraindications. One of the other things that we would say is if you're at a high risk for pancreatitis, in other words, your triglyceride levels are off the chart and you've had active pancreatitis, That's a pretty good contraindication to starting these medications. Again, studies have shown that these medications can cause pancreatitis. Now, it may not be a true contraindication. Everybody's a little bit different. Again, come talk to us. Let's figure out what the driving force was. Let's figure out what happened, what's going on. We may be able to say, that kind of really wasn't what was going on in that situation. Go see your PCP. Again, you've heard Nicole and I preach, you need a PCP. Get clearance, come back and let's get you started. So the medullary thyroid cancer, multiple endocrine neoplasia type 2, those are the absolutes. Not meeting a certain weight, that's an absolute. But sometimes some of the other ones we can work with. So just come see us. We can chat about it and tell you if it's an absolute contraindication, but those are the big ones.
Yeah, for sure. Obviously, pregnant planning to become pregnant or breastfeeding.
Yes.
Okay. Because I'm like you, I have not seen the medullary thyroid cancer diagnosis. However, I have had at least one, I think two pregnant patients looking to get on this medication.
Have you really?
I have. And I am like, what? Of course, that's a very, very hard no, but it is what it is nonetheless. To touch on the triglycerides, you can have high triglycerides and need GLP-1 therapy, and that's appropriate. It's when your triglycerides are like off like over 500, there's something definitely that needs attention. So, like Kelly said, just come see us and we'll let you know. Our job is to rule you in to be okay to take it. We want you to be able to be healthy and to be able to lose the weight. There's 9 cancers directly related to obesity. That has been studied for centuries probably. And so, we always want to weigh the risk versus the benefit. I recently saw an article that was saying that Ozempic or I think it was Ozempic, but semaglutide regardless. It said something about some concern with certain eye conditions.
Mm-hmm.
And my response to that is, has anyone ever heard of glaucoma? Like,
yeah,
that is blinding caused by diabetes, caused by obesity. Like,
yep.
Nobody mentions in the article about that. It's higher likelihood in life that if you are overweight, have diabetes, you're going to have glaucoma, which is preventable if we can get your weight under control and have you in a more overall healthy state and avoid or get rid of your diabetes. Because diabetes type 2 typically is reversible. It typically is if you can get the weight and there's not other factors going on. Now, it's not going to go away overnight, but there's things that you can do. I mean, most of you can probably remember when you were pre-diabetic and then you got older and things got a little bit worse. Maybe the obesity got worse, or other conditions got worse. And then you became diabetic, right? You weren't born diabetic like type 1 typically is. Type 2, it's preventable in most cases. Now, not every case, but in most cases it is. And so glaucoma is a very real risk of diabetes type 2. My grandfather had glaucoma super, super bad. He was legally blind. I mean, he could see, but he was legally blind. And it's all because of diabetes. So I feel like there's a lot of things out there where you really need your provider to just say, is the risk worth the benefit? And is it, do no harm first, right? Kelly and I are very driven to get patients healthy. And if you're already healthy, let's stay healthy. If you're in that pre-diabetes or in that, we want to help you now. We want to help you now.
That kind of goes back to something we've talked about here before is figuring out a provider that offers you something that you are looking for. Like, when you're choosing a provider, we've talked about that. And I know Nicole does a great job of it. And I spend a lot of time doing this, spending just a ton of time, not only going over the medication and talking about risks and side effects, which Nicole's going to hit on here in a second, but having a provider that talks to you about your nutrition and your health and your exercise and doing all the other things that go along with this, because this is a lifestyle change. You get the weight off, you want to keep it off, and you want to be healthy for doing that. And so part of avoiding the complications of prediabetes and diabetes, is getting healthy. And Nicole and I, we spend a lot of time with our patients because health and wellness means so, so much to us. We're not sitting here to hear ourselves talk. This is something that we feel so passionate about. It's why I went into functional medicine. It's why she continues going back to school and learning and learning and learning, because we want to do everything we can to make sure that our patients have the best of us for the time that we have to give it. And I think that's what drives me every day is what more can I do to give the best to my patients? And so that, that pushes me into talking about, macros. I spend a lot of time breaking down nutrition for my patients. And I tell them, load up an app on your phone, put an app on your phone. I use my Fitness Pal. I encourage my patients to use my Fitness Pal because it's free.
I love it.
You load up your height, your weight, and your weight loss goal. And I tell my patients 1 to 2 pounds a week. That's respectable weight loss. Anything more than that can be a little questionable. And it will tell you what your calorie intake should be every day. And then you can take that and you can break down your macros. You can load up and tell the app what you want your macros to be. And your macros are fats, carbs, proteins. Those are your macros. And then I tell them I want you to have 40% carbs, 30% fat, 30% protein starting out. That's where I want you to be. And when you start seeing your intake, it kind of starts to make sense. Like, I don't know about you, Nicole, but the first time I actually started tracking my macros and putting in my food, I was like, holy cow, there's that much fat in an egg. Like, eggs have that much fat, really? And then I would spend the rest of my day planning my food and be like, oh, I got to eat a can of tuna today to reverse the eggs that I ate this morning. And then planning became a little bit easier. But it gets you to where you start realizing that you really do have to pay attention to making sure you get enough, because these medications are designed to pull weight from you, and not getting enough protein pulls muscle from you as well. Your body's going to lose weight. It's going to lose weight wherever it can. So making sure that you stay healthy and protect your bones and protect your muscles, you really have to be sure that your protein intake was adequate. You really do.
Yeah.
I read an article, I think it was yesterday or day before, about osteosarcopenia, which is bone and skeletal muscle loss. And, skeletal muscles line your bones. So it's the bones that protect the muscles, or the muscles that protect the bones. Let me get that right. And when you start to lose muscle mass and you start to lose bone mass from rapid weight loss, that's sometimes very difficult to reverse. So being sure that you're staying up with your hydration, your macros, your nutrition is incredibly important in these situations. Hydration is another big one. I hit that just now. I tell my patients you should be drinking half your body weight in fluid ounces. If you can't remember that, 2 liters. Just drink 2 liters of fluid. That's kind of a big round number, but half of your body weight in fluid ounces. It's another easy way to remember it. If you weigh 150 pounds, 75 fluid ounces of water a day. Getting those things together takes some time. It's not something that I expect my patients to do overnight, but we talk about it every time they come in. We chat and say, where are you with your nutrition? How have you been able to reach your macros? And if you haven't, fine, let's talk about it. Let's see what little things that we can throw in there to help you reach those goals. How are you with drinking your water? How can I help you reach that goal? Can I give you some tips and tricks to get there?
Yeah, that's very good. I like the MyFitnessPal app, and I've never been into you're very, very good at macros and all of that stuff. I'm not so good at that, just so you know, full transparency. But I have used the MyFitnessPal app, and I like that I can scan whatever I'm eating and it will tell me all of the data.
Barcode.
So,
Yeah,
like, if
barcode.
you type in Dunkin' Donuts, it will give you the option for all their coffees and creams and everything. It's so easy. Like, everything is in there. Like, even
Yeah.
lasagna is in there. You can scan the back of anything, the back of a bag of chips, the back of
Yep.
a stick of gum, and it will tell you on there. It's super easy since it's been able, and that's been, geez, a couple of years since I've used that, but it is a really, really good app. So I'm glad you brought that. It's awareness. It's just awareness. I tell patients with that, like, just get the app and just don't change anything for the first couple days. Don't change it. Just eat how you eat and just see where you're at, because
Yeah.
we don't, otherwise you don't know, right? So just see where you're at. It is eye opening. Like it is very, very eye opening. So that's very good. I like that. So yeah, I'm going to touch on the side effects. The most common side effect is going to be that GI upset, that feeling like you had a big Thanksgiving meal and you're like, I don't want to look at food. I don't want to smell food. I don't want to talk about it. Just like not like that type of feeling. And that's okay. If you have a GI upset, I would recommend Tums, Pepto, Pepcid, all of those things. If you have nausea, um, Tums, Pepto, Pepcid. Of course, we can use Zofran prescription, but it's usually not needed. Small protein meals throughout the day, a small handful of almonds or a protein shake or something will help kind of keep something in your stomach. Because we all know when we haven't eaten over several hours or we've missed a meal or two, our stomach starts to burn. It's like, oh, I got to get something to eat. And you may have that because you're not eating. The day is gone and you've realized your food noise is gone and you've realized you haven't eaten anything. You probably haven't drank anything either. So just be mindful of super hydration and diligent with hydration. But that is the most common side effect, is that feeling of, oh, and then the nausea. If you are having like explosive diarrhea, uncontrolled vomiting, that is a super good indicator that your dose is too high. And that's why we start on a very low dose. Everybody should start on the starting dose because everyone is so different. I have patients that, there's 5 doses of one, 6 of the other. Some patients go to the high dose, some patients stay on the low dose, but most patients find a sweet spot in the middle where they're getting good appetite suppression and good weight loss. The idea is weight loss and appetite suppression, not to climb the dose. So especially if you're using the compound option where the higher dose you go, typically the more it costs. Save your money. Just save your money. You don't want to go up unless you have to. If you're getting good results, stay there. I could only go up to the second dose. I tried to go up to the third dose and I was like, Lord Jesus, take me. Like I was so sick. So definitely like every patient, we can't put in a box and say this, and this is the way that your dosing is going to go, because that is not going to be the case with this. It is very patient specific. My spouse went all the way up to the top. No trouble. I was like, oh no, nope. Like, but we both had the same results, right? It's all about tolerance. It's all about genetics. It's all about hormones because I'm perimenopausal. I'm in my mid 40s, right? So all of that, especially men and women, the difference is pretty significant, but everyone is different. Eating habits, activity, genetics, hormones, like there's so many things that play into the tolerance of this medication that no one patient is the same. No one patient is the same. But the side effects, most common is going to be that nausea, constipation. If you're not hydrated, you will get constipated if you're not diligent with that hydration that Kelly was talking about. You want to make sure that you drink those ounces. Get your favorite cup, carry it around, because the food noise, there's no magic in medicine, right? There's no magic in medicine. But if there was, this is pretty damn close, right? Because it turns that food noise right off. And you go about your day and you're like, wait a minute, it is 4 or 5 o'clock. I have not eaten anything. And with that, if you're not diligent, you haven't drank anything either. So you do want to make sure you protect your kidneys and don't get dehydrated and things like that, because that's a whole nother issue. So as far as the side effects, those are the main ones. If you have anything that's abnormal, make sure to reach out to your prescriber just for some direction or for some help. Obviously, if you're seeing a telehealth provider, anything urgent or changes, see your in-person emergency provider, certainly, or call your PCP who can actually lay a stethoscope on your bowels and make sure that they're still doing what they're doing, because it does slow our gastric emptying. That's what it does by nature. But for the most part, it's just that nausea, yucky feeling, and constipation. Those are going to be the 2 main ones. It's so cute. I had a patient a couple of weeks ago say, I'm on my 2nd month of this, and on my way home from work, I would always go through McDonald's and get a small fry. And that's just because I love French fries. I love them. And now I don't even want them. And it makes me sad a little. And I'm like, I get that. Like, I get that. I had another patient tell me, she's like, I like a glass of wine at night. And she's like, I just don't want it. And she's like, I enjoyed my wine. And I'm like, well, okay, if that's All right, ladies, if this is your biggest complaint, let's take it. Okay, let's just take it. So definitely people get in their routines, like in the mornings, I have coffee. Like if I didn't want my coffee one morning, I would be like, what is going on? But that's how I get going. That's how I get here, right here in front of you. So probably the last thing I want to talk to you about is de-escalation. How do I get off this medication? Can I stop it? I've had patients tell me all sorts of things. I've had them tell me, well, so and so told me I can never get off it. So and so told me. I mean, there's so much out there. Truth be told, you can go off cold turkey off this medication. And people are like, well, what if I gain the weight back? If you go to the gym every day for 6 months and then you stop going, you're going to go back to the way that you were. So the idea is your habits have changed, your stomach has shrunk, you have so much more awareness of what you're putting in your mouth. If you go back to the way that you did before, you will gain the weight back. That's the way it goes. So this is like, you have to maintain, you have to stay the course, right? But you can go off at cold turkey. Not everybody does that. Some patients, they'll do a de-escalation where they want to go down a dose and see how they do for maintenance. Sometimes for the brand name, they will space them out a little bit. With compound, you can't really do that because the beyond use date, but for the brand name, you can space them out a little bit. It's okay, a couple days extra. But if you go too far where you've had a lapse in therapy, you got to start over again because you've got to build up that tolerance. So you just have to just be careful and make sure you follow the directions of your healthcare provider to make sure that you are getting off of the medication the right way. If you're going to stay on it, that's for maintenance, that's fine too. There's so many ways to handle this once you've reached your goal. And it's just about you individually as a person. And so that's what really me and Kelli are want to get across to you, is that every patient is so different. So if you have any questions, reach out to us. We'll be happy to talk to you. I do 15-minute video visits just for you to pick my brain. I don't ask for any financial information. I just want everyone to be educated. So part of that is this podcast. If you have personal questions, we can certainly do a one-on-one. Go to hamiltontelehealth.com and schedule a visit with me. I won't ask for any credit card information. It's just time to get those questions answered for patients that are on the fence of, is this good for me or is it not? And if it's not, then Kelli and I both will tell you, no, it's not good.
Yeah.
It's not good. And sometimes we'll send you in person, say, look, you need to be monitored closely. So this really needs to come from your in-person provider. And if that's the case, that's the case. It's pretty rare, but sometimes we have patients that are more fragile than others. And that's just the best option for them, is to get it from in person.
Yeah. And I think that's probably the most important piece that we can hit home is if a provider that you've done your due diligence, you've done your research, you trust them, you know that they are shooting straight with you. If they tell you this is something that you really need to be followed in person, please do that. Please don't hop to another telehealth provider just because they're willing to do it for you. There was a reason they told you that you needed to be followed in person. It's very rare that I tell a patient that. If I tell a patient you should really be followed in person, and I know Nicole is the same way. If we tell you, wow, this really needs to be followed in person, I think this is a great program for you, but someone needs to have hands on you and be following you just a little bit closer than we can do through a computer screen. It's because we care about you and we care about your safety and your health and your wellness, and we want to be sure that you're getting adequate care. So please just understand that we really are doing that because we care about you as a person and your wellness, not because we're being ugly or picky or anything like that. Has nothing to do with finances. We just want what's best for you. So the only other thing that I would throw in here about de-escalation and things like that is, like Nicole said, it really, really is a lifestyle change. Like she said, you spend all this time doing all of this hard work. When you get ready to come off of the medication, the lifestyle change has to be there. And you can do all of this hard work, but if you don't continue the hard work after the medication is gone, then the weight certainly will come back. So respect your hard work and keep it up.
Yeah, very, very good. All right. Well, thank you guys for joining us today. That's a wrap. You can find me at hamiltontelehealth.com, and you can find Kelli at
ChariHealth.com, CHARI health.com.
Yep. And we'll see you next time.
All right. Bye, guys.